8 years after a man-made flood disaster, community members of Little Saskatchewan First Nation have returned to their homes and ancestral land in 2019. Despite the relief of coming home, they are faced with toxic mold and health risk.
And the effects on the community totally destroyed our land-based the portion of our community right along the shore of the lake, and our people lived fairly comfortably. We're used to living close to the water, and to be flooded out like that, it's not the best of things. And people were evacuated because housing and roads were affected. High water, mold issues created by high moisture levels. So that housing needed to be replaced, and people were evacuated to mostly Winnipeg and other outlying areas.
Health and environmental risks increase from the absence of a safe waste management facility.
You know, people that stayed back here, I'll give you an example. My own sister got really sick, her and her husband. They got very, very ill, and I begged her. I said, why don't you move here? I told her, come and stay with me. Move to the base. I said, don't stay here. You're getting sick. These toxic, this toxic stuff, this contaminated stuff you're just getting more sick here. I said, they got very ill, both of them. Lots of stuff that can be recycled is all over the ground, all over the community, everywhere. Like, that stuff could be recycled if we had a recycling, but there is no recycling project. People tend to burn, and that's not good either, and they should be going to a recycle depot. And if we had a recycling depot, lots of benefits. People, there'd be employment, it would be cleaner and, and reused, not wasting anything.
In coming home to Little Saskatchewan First Nation after 8 years displacement, flood survivors face health risks of mold and toxic contamination by waste and sewage. Flood victims need further funding and programming. A regional waste management center would provide recycling, compost, and safe disposal of waste.